Hello students, we will discuss again one of the common condition as such grossly, but may not be this site, a swelling. So just see and tell what this condition or swelling is. See that ear, female patient, there is a ear behind the ear upper part, this point important, behind the ear upper part there is a swelling, maybe smooth, well localized swelling. So you have to find out skin free or not, you have to find tenderness, you have to find out temperature, you have to find out surface, you have to find out consistency, you have to find out skin is free or not, you have to find mobility in two direction, very important. Then you have to find out whether extending to the ear or not, and you have to measure it horizontal and vertical and horizontal in centimeter. Then you have to see fluctuation present or not by in two direction, otherwise pages method of fluctuation, indenting over the summit to get yielding sensation. Then you have to check transvalination, then you have to check opposite side, you have to check neck lymph node. Then you have to do a basic systemic examination, may not much relevant here, but opposite side and neck lymph node should be examined always, and scalp should be examined for any other such similar swellings. That is the basic clinical examination you have to remember. So this is the post-auricular dermoid, typical, upper part of the ear, not lower part, here, behind the ear, post-auricular dermoid. Different diagnoses are lipoma, neurofibroma, sebaceous cyst, because skin is adherent in sebaceous cyst. Neurofibroma, it will be firm and not cystic, and some amount of hyperesthesia or nerve pain will be there, tenderness will be there. And lipoma is a common, very universal tumor, ubiquitous tumor. Lipoma could be a differential diagnosis, many such local swelling, remember, but it's soft, clip sign, skin is free, well localized, non-tender. So post-auricular dermoid occurs along the squamo-mustard feature line. This is the MCQ question, remember. Which side, all dermoids, pre-auricular, post-auricular, external angular dermoid, internal angular dermoid, dermoid in the forehead, all those dermoids, which suture line it occurs. It's a sequestration dermoid, remember. Other dermoids are implantation dermoid, tubulodermoids, and teratomatous dermoid. But sequestration dermoid is common. Each one, which suture line should occurs or develops, is an MCQ question which you have to remember. So here it occurs squamo-mustard suture line in the upper part of the temporal bone, upper part of the behind the ear in the temporal bone, occurs upper part behind the ear. That point also remember, same typical area. So that point you have to remember. So dermoid, sequestration dermoid, different types, go through how to examine swelling, go through my clinical method in surgery, and detail about dermoid, sequestration dermoid, other dermoids, read my swelling chapter in the manual of surgery, and how to remove these swellings. Of course, you do CT scan always, imaging is important. After that, usually dermoid should be removed under general anesthesia. That point is very well to be remembered. How to do that, you can always go through my operative surgery, of course, tissue approximation through the suturing technique. My indigenous lecture through JP gives a detail about all these things, everything to cover UG and basic for BGs. So students, I hope you understood this post-auricular dermoid in specific and dermoid in general very well. Thank you very much.